Hello viewers, today's topic for discussion is abdominal aorta and inferior vena cava. So let's start with abdominal aorta. As we already discussed in the previous video that it begins in the midline abdominal aorta and at the aortic opening of the diaphragm at the level of T12. I already discussed VOA, vena cava opening at T8, esophageal at T10 and aortic at T12. Right, so it runs downwards and towards the left in front of lumbar vertebra and ends in front of the body of vertebra L4, right, about 1.25 centimeter to the left of midline, right, towards the left side. So by dividing it into two iliac arteries, right. So due to the forward convexity of the lumbar vertebra, aortic pulsations can be felt in the region of the umbilicus, right. Now relations. Anteriorly lies the celiac trunk, right, and aortic plexus, body of pancreas, and third part of duodenum. Posteriorly lies the body of four vertebrae, first four lumbar vertebrae, anterior longitudinal ligament. Towards the right side lies the inferior vena cava, right crest of diaphragm, cisterna coeli, ischius vein in the upper part, right. Then to the left side, towards the left side lies the left crest of the diaphragm, pancreas, and fourth part of the duodenum. Let's discuss the branches. As I already discussed in my previous video, we have ventral and lateral branches. Ventral are the celiac trunk, superior mesenteric artery, inferior mesenteric artery, right. Superior and inferior mesenteric artery I have discussed previously in the previous video. In this video I will describe the celiac trunk and the lateral branches, right. The lateral branches include, number first is inferior phrenic on both sides. These are the bilateral. Lateral are the inferior phrenic. I have written here also inferior phrenic artery. Then we have middle suprarenal, right. I have written here middle right suprarenal. Middle suprarenal artery. I have drawn here, right. Then we have renal arteries. These are the renal arteries, right. Then we have testicular and ovarian arteries, okay, gonadal, right. Then we have dorsal branches. These are the lateral. Dorsal branches are the lumbar arteries, 4 pair, 1 2 3 4. These one are the lumbar arteries. These are dorsal branches, and one median sacral branch. These are the dorsal branches. So let's summarize. Lateral ventral branches are the celiac trunk, superior mesenteric artery, inferior mesenteric artery. Lateral branches are the inferior phrenic, middle suprarenal, renal arteries, gonadal arteries, testicular or ovarian arteries. And the dorsal branches are lumbar pairs, 4 pair of lumbar arteries, and median sacral arteries. And the terminal are the common iliac arteries, right. Let's start with the inferior phrenic artery in detail. Inferior phrenic artery arises from the aorta just above the celiac trunk. This is the celiac trunk. It arises just above the celiac trunk. Each artery runs upwards and laterally on the corresponding crest of the diaphragm, medial to the suprarenal gland, right. Then each artery gives off 2 to 3 suprarenal arteries and is distributed to the diaphragm. Then we have middle suprarenal arteries. These are the middle suprarenal arteries. They rise at the level of superior mesenteric artery. This is the superior mesenteric artery, and they rise at the level of the superior mesenteric artery. Each passes laterally and slightly upwards over the corresponding crest of the diaphragm to reach the gland, right. Then we have renal arteries. These are the large arteries which arise from the abdominal aorta just below the origin of superior mesenteric artery, right. This is the superior mesenteric. It lies below the origin of superior mesenteric artery. Right renal arteries. Right renal artery passes behind the inferior vena cava to reach the right kidney, hilum of right kidney, and the left renal artery runs behind the left renal vein and splenic vein. Each artery gives off inferior suprarenal and ureteral branches and is then distributed to the kidneys. Now the gonadal arteries. Gonadal arteries are small and arise in front of the aorta, a little below the origin of the renal arteries, right. On the right side, the artery crosses in front of the inferior vena cava. I have drawn inferior vena cava, right. Towards the right side, the artery crosses in front of inferior vena cava, the ureter, and the genitofemoral nerve, right. It passes deep to the ileum. On the left side, the artery crosses in front of the ureter and the genitofemoral nerve and passes deep to the colon. The testicular artery joins the spermatic cord at deep inguinal ring and traverses the inguinal canal, right. And the ovarian Artery crosses external iliac vessels at the pelvic rim to enter the suspensory or infundibulopelvic ligament of the ovary, right? So these are the gonadal arteries. Then dorsal branches, number one is lumbar arteries and median sacral artery. Lumbar arteries, there are 4 pairs, right? They lie opposite the vertebra level, L4, L1, L2, L3 and L4 vertebrae, right? Then these pass deep to the crura, deep to the psoas major and quadratus lumbar to end in small branches. Each artery gives off a dorsal branch which arises at the root of transverse process. The dorsal branch gives off a spinal branch to the vertebral canal and then run backwards to supply the muscles and skin of the back, right? Then we have median sacral artery, which is a continuation of the primitive dorsal aorta, right? It arises from back of aorta just above the bifurcation of the aorta, right? And runs downwards to end in front of the coccyx. It supplies rectum and anastomosis with the lateral sacral and iliolumbar arteries, right? Now, terminal, that is common iliac arteries. These are the terminal branches of the abdominal aorta, beginning in front of L4 vertebra, about 1.25 centimeter to the left of median plane. On each side, it passes downwards and laterally, and ends in front of the sacroiliac joint at the level of lumbosacral intervertebral disc, right? By dividing into internal and external iliac arteries, right? These are the common iliac arteries. They divide finally into external and internal iliac arteries. The right common iliac artery passes in front of the inferior vena cava. Right common iliac vein is posterior to the vena cava above and medial to it below, right? Left common artery is shorter than the right. It is crossed at its middle by inferior mesenteric vessels. The left common iliac vein is medial to it. The structures lying on the left L of the sacrum are the sympathetic trunk, lumbosacral trunk, lumbar artery, and then obturator nerve. The relation is OILS, O-I-L-S, right? So the structures on the L of the sacrum are sympathetic trunk, lumbosacral artery or lumbosacral trunk, then lumbar artery, iliolumbar artery, right? Iliolumbar artery and then obturator nerve, right? So this is the OILS relation. So these are the ventral and the dorsal branches of the abdominal aorta. Now let's discuss the celiac trunk, the ventral branch which I left, right? Superior mesenteric artery, inferior mesenteric artery, I have discussed in previous video. Let's discuss the celiac trunk. So celiac trunk is nothing actually, but it is the celiac trunk supplies the stomach, right? Let's start with its branches. So this is a left gastric artery. The left gastric artery, branch of the celiac trunk, it supplies the lesser curvature, right? The right gastric artery, this is the right gastric artery. It is a branch of, this is a right gastric artery. It is a branch of the, this is a right gastric, proper hepatic artery. This is common hepatic artery. I have written here common hepatic artery, which further continues as proper hepatic artery. This is proper hepatic artery. Proper hepatic artery gives a branch which is called right gastric artery, right? So celiac trunk, lesser curvature, we have 2 branches, left gastric artery, which is a direct branch from celiac trunk, right gastric artery, which is a branch from proper hepatic artery. Proper hepatic is the continuation of the common hepatic artery. Celiac trunk gives common hepatic artery, which continues as proper hepatic artery. Proper hepatic artery gives a branch called right gastric artery, right? So along the greater curvature, it is supplied by gastroepiploic artery, which is a branch of gastroduodenal artery. So the gastroduodenal artery, this is the gastroduodenal artery, this is right gastroepiploic artery. So along the lesser curvature, it is supplied by gastroepiploic artery, which is a branch of gastroduodenal artery, right? The left gastroepiploic artery, which is a branch of splenic artery, right? Then fundus is supplied by 5 to 7 short gastric arteries also. These are, I have drawn here, short gastric arteries, which are also branches of splenic arteries, right? So this is all about the, this is all about the blood supply of the stomach. Now the inferior vena cava, the last topic which I left is inferior vena cava, right? Tributis. So inferior vena cava is formed by the union of the right and left iliac veins, right? On the right side of the body of vertebra L5, right? It ascends in front of the vertebral column on the right side of the aorta, grooves the posterior surface of the liver, pierces the central tendon of diaphragm at the level of T8 vertebra, and opens into lower and posterior part of right atrium. Right? Now relations. Anteriorly lies the anterior lies the posterior surface of the liver, epiploic foramen, first part of duodenum, portal vein, head of pancreas, and third part of duodenum. Posteriorly above is the right crus of diaphragm. Right, below it is related to the right sympathetic chain. Now tributaries. The first one is common iliac vein. These are the tributaries, right? Then third and fourth lumbar veins I have drawn here. Third and fourth lumbar veins. Then we have veins actually corresponding to the arteries also, right? First are the common iliac veins. Then we have third and fourth lumbar veins. Right and left testicular or ovarian veins, right? Then we have renal veins, right? Then we have right suprarenal vein. This I have drawn right suprarenal vein. Renal veins, these are the right suprarenal veins. These are the testicular and ovarian or gonadal veins, right? Then we have hepatic veins. These are the hepatic veins, right? Let's summarize. These are the common iliac veins. Then we have third and fourth lumbar veins. Then we have gonadal veins. Then we have suprarenal veins. Then we have hepatic veins. One more thing is important here is the testicular and ovarian, right one. Testicular and ovarian, they open into the inferior vena cava just below the entrance of into the renal veins, right? But the left gonadal veins, they open into the left renal vein. This is the renal vein. So the left gonadal vein, they opens into the left renal veins, right? So this is the difference. Right testicular or ovarian veins, they open below the entrance of the renal vein, while the left gonadal veins, they open into the renal veins, right? So this is all about today's lectures. Today I discuss the celiac trunk, ventral branch, right, and the dorsal and the lateral branches of aorta and inferior vena. Thanks a lot.